Hi, I'm Dr. Bhargav Rao from Pathofast Lab in Pune. If you have problems like menstrual irregularities, irregular periods, hot flashes, or difficulty getting pregnant, your doctor may have advised something called an estrogen or an estradiol or E2 test. And today I'm going to tell you everything about this blood test. To start with, what is estradiol? Well, this is the main hormone that is responsible for all the secondary sexual characteristics that we see in women, in adult women, especially development of the breasts, the changes in all the hormones, the change in the way the skin looks. All these things are controlled by the estrogen. It is produced by your ovaries, which are two tiny glands which are present right next to your uterus, somewhere below your stomach. They are also produced in small quantities by the adrenal gland, which are present above both of your kidneys. Estrogen or estradiol is actually present in three forms in your blood: E1, E2 and E3. We are only interested in E2 because that is the dominant estrogen in your blood. E3 is only got any importance during pregnancy. Lastly, this is not only required for the proper development of your secondary sexual characteristics, but also for your proper maintenance of your menstrual cycle, growth of your nervous system, and having a successful pregnancy. That is why this blood test is very important. What are some reasons or some symptoms that can point to something wrong with your estrogen levels that would make you need to have this test? So, fatigue, changes in weight, mood swings, low libido, irregular periods, hot flashes, feeling very warm, fractures, especially after you've had your menopause, or facial hair and acne. All these are signs there's something wrong with the control of your hormones, maybe with your estradiol, and that is something that should provoke you to get this test. So what are the reasons because of which we really need to do this test? What does this estradiol test tell us? Why did your doctor even ask for this test? So let's divide it into three groups. Women who have problems with getting pregnant or infertility. In infertility, your doctor wants to know whether your ovaries are working normally or not, because your ovaries produce the egg that is then fertilized by the sperm. If your ovaries are not working properly, you're not going to be able to get pregnant. Estradiol or the estradiol or E2 level tells us whether your ovaries are working properly or not based on its level. Secondly, there could be another problem, and it could be that your pituitary, which is a gland in your brain which is responsible to actually stimulate your ovaries to release the egg, are not working. Your pituitary is not working properly. So your pituitary doesn't work properly, it doesn't stimulate your ovaries to release the egg, and you cannot get pregnant. The third thing is, if you have also got other problems together with infertility, like you're missing your periods are irregular, you have a lot of hair on your face, or maybe you have acne, all these things are pointing to something called PCOS or PCOD. I've got a separate video on that, but the estradiol level helps us to know whether you have this syndrome. Now let's look at the second, the reason to have this test, which is women who are undergoing IVF or those who want assisted reproductive techniques to help you to get pregnant. Estradiol or the estrogen level helps us to know exactly when you're ovulating. It's totally correlated with the time of your ovulation, which is something that happens around mid-cycle. There is a change in the level of estradiol, and this helps your IVF specialist to know exactly how to go ahead with the treatment. So this is the second situation in which you need to get this estrogen test done. The last situation is in older women, those who are above 45 or maybe 50, because these are the women who have something called menopause, where your ovaries stop releasing the eggs and your menstrual cycles halt. They may have symptoms like hot flashes, feeling very hot, mood swings, depression, changes in the weight. All this stuff happening around the age of 45 or 50 could be a sign of menopause, and the estrogen level helps us to know whether you whether you are actually in menopause or even perimenopause. Lastly, women who are taking HRT, which is hormone replacement therapy for menopause, this test helps the doctor to know exactly what dose of this therapy you should be taking. So these are all the reasons why you may need to have an estrogen test or an estradiol test done. So how is this estradiol test done? This is a simple blood test. You have to visit the lab, provide a sample of your blood, and they'll give you the report probably by the end of the same day or the next day. What is important to remember is you should get this test done on the third day of your menstrual cycle. This is the best time to do it because it gives us a baseline level. You have to remember that if you're on any kind of birth control or if you're on any kind of hormone replacement therapy, you must tell the lab about this because this can affect your results. And lastly, this is a test that is done on your blood sample. You don't need to provide any other kind of sample for this test. I've included the list of normal ranges in adult women for the estradiol or E2 test on this page. You can see that during pregnancy the level goes way higher, and that it drops after menopause, and in non-pregnant adult women the normal value is expected to be between 15 to 350. You must remember that even during every phase of your menstrual cycle the normal expected range is slightly different, so please check with your lab. What are some reasons because of which you could have an abnormally high estradiol level in your report? Well, there are few reasons. One is PCOS or PCOD, polycystic ovarian syndrome, in which you have very high levels of male hormones in your blood. This can give you a high level of estradiol. Estrogen releasing cancers, these are cancers in the ovary or maybe in your adrenal glands that are secreting very high levels of estrogen, because of which the level is high. In younger girls, early puberty is one cause where we might see a high level of estradiol. Pregnancy, and of course hormone replacement therapy, where you're actually taking hormones to supplement a low estradiol that you have in your blood, that can produce an abnormally high level on your blood test reports. Now, what can produce a low level? Well, if your ovaries are not working properly, this is called ovarian failure, or you have had menopause, both these things will give you a very low level of estradiol. If there is something wrong with the pituitary gland in your brain, it is not stimulating your ovaries to work properly, that can also give you a low level of estradiol. There are also genetic conditions in which you can have a low level of estrogen.